It is a beautiful technique. It works really well. It can be there's no like first technique, backup technique, that sort of thing. It can be your first line, it can be your second line of defense, but for me, oftentimes, it is the thing I'm following up with after my body drop. Because I know in my brain that I'm not going to be able to get a tighter, crispier drop force into a pelvis or low back than that body drop I showed you yesterday. So it is my first line of defense, but that's just my opinion. I'm going to drop on someone like that if I want the forces into the abdomen. And then I'm probably going to come behind them with this. And these are people that have this chronic pelvic pain or just this SIJ related pain. It could be both joint and that connective tissue stuff we talked about yesterday, the ligaments, all of that. But treat the joints, treat the tissues. And this is how I'm treating the joints. So if any of you felt that nice drop on the SIJ yesterday and how it felt like stretchy to those ligaments, it does. You can feel that SIJ kind of like gap and stretch a little bit. This is the same way. I'm going to show you how we're going to do the same kind of physics to the SIJ, and we're going to drop heavy onto it. What I've then developed from that, and this doesn't say it in your book, it's just what I do on a real patient, is I will sit there for a little while after that and do some mini manips, as I call them. So whether I crack it or not, I'm always trying to crack it. And oftentimes it will, but sometimes it won't. And let me ask this yesterday. The only place on the spine that will get better if it doesn't crack is the SIJ. So some deep mobs into the SIJ, well-targeted angles, will help decrease SIJ pain without a crack. Obviously try to crack it, but then I'll come behind it. But I'm not just going to mob it, because I know all the physics. And I know there's sharp, quick motions with the gamma motor neurons and the inhibitory interneurons and the stretch of the capsule and all the things. Like the quick motions work better than the other ones do. So that's why I do mini manips, not just call it multiple mobilizations. So I'm going to get in the same position, jump on it hard, and then what I might do is stay there for 2 or 3 minutes and start doing some quick other motions in the same position. So I'll kind of show you that as we go. We'll be lining her up here for a right-sided SIJ situation. When we did the body drop, we put her in rotation and side bending to the same direction with extension, right? And that locked down the low back. Same rules apply here, but she's in prone. So we got to put her in rotation and side bending to the same direction. What I'm going to do with her first is rehearse a prone press up. We all know how to do it, but you know darn well patients have a problem with it. So I'm going to get her into like a sphinx position, right? And I want you to do a prone press up. So palms down, prone press up. Beautiful. Now go down. Now what I want you to do is just press up with your right side. Yeah, so do a unilateral prone press up. See, this is why you have to rehearse it. Just press with your right side. No, not with both. If you just press with your right, push. You're going to come up on just one side. The left shoulder goes down, the right one comes up. So you're getting what here? Right rotation and extension. She's going to rehearse that so she can give that to me on her own. Keep going. Beautiful. See? And she knows what she's doing. So think about Mr. Jones or Mrs. Jones you're trying to get to do this. It takes a little rehearsal and teaching to get them to do that. But this is active prone press up, unilateral prone press up. Beautiful. Left shoulder down, right shoulder comes up. Yeah? So that gives me rotation and side bend and rotation and extension. Now I also want side bending to the same direction, don't I? She doesn't have to help with that. She's laying where she is, be a dead body, don't help out. I'm just going to take her pelvis, don't help, and slide it to me. People will try to reshift and whatever their body, I don't want that. Have you ever done a lateral shift correction against the wall? You can feel how specific and local and stretchy that is down there. That's what I'm trying to do, is give her a passive lateral translation of her pelvis. So now she has right side bending. You can even maybe throw these over here if you want. And it brought the SIJ over towards me more, and so now I can get up over it. Same rules apply with the tie. And I've given her right side bending. When she does the prone press up, she's going to then hand me right rotation and extension. Right? Same position we did on the body drop. So now, take the palm of your hand and grab her PSIS with it. And then reinforce that with the other hand. Elbows are straight, up, over. Look at my body position. I am not here. Back is bent, knees are hitting the table. Can't do that, right? Pivot and turn your body and get to here. Got it? So now when she starts to come up, go ahead and do the press up. Keep going. See where there's a moment, she's pretty flexible. Where there's a moment where her pelvis starts to come up off the table. That's the moment I'm going to start to feel, keep going, up and down, right there. That's where it starts to come up. So I'm going to give it a little resistance. And I'm going to start to understand where that moment is. So on maybe her 5th or 6th one, I get up over, and as soon as she starts to come up, pelvis peels up, bam, I drop down into it. So two things in opposite directions is going to give you double the result. Right? So come on up. I'm just going to pin it down. Good. Up and down. Keep going. Up and down, up and down. Good. And get my body ready. Right? Feel that moment right there. Now the next one, when she comes up, boom, drop down through it. Sharp. And you feel a stretch. Isn't that when she make a face? What are you laughing at? Yeah. It feels super stretchy to that spot. Super stretchy. So I will try to crack it, and oftentimes it will crack here. Everything's tightened up. There's nowhere for it to go. If it can move and crack and make a noise, it's gonna. If you're in this position, I mean, everything is super tight. Boom, drop straight into it, sharp. Do it really fast. Not muscly here, just boom, drop your weight and do sharp. And then I may stay here and do several of these. Keep going, I won't do it that hard anymore. But if this is really sensitive and painful, like people don't mind this. It kind of hurts, but they know it's like a good hurt. It feels good. All right, go. So I'll just stay here and I'm just gonna drop. No arms, just all legs. Each time she starts to come up, bam. And I may stay here for a couple minutes and just do this. You're gonna find that when the first one was uncomfortable, you get to 2 minutes and they're like, that doesn't hurt anymore. It starts to improve the tolerance to that pressure because of the continued stretch moment you're giving it. Cool? That's active prone press up. Yep.
The contact hand was the PSIS?
Yep. So PSIS is the I and SIJ, right? Hey, a little friend on your shoulder. Is this the angel or the devil? Which side is on this one? All right. So the innominate is there. You're going to grab it like this and get up over it. Okay? So you're just shoving the innominate straight down. There is an angle there. You guys probably remember what the angle is. It's not the same on everyone, but it's not a straight down kind of an angle, which is why, by nature of you being on the other side, you're going to get a little bit of that angle. But don't try to shove it like that. Go straight down. Okay? Cool. All right, hang tight. What we can also do is a passive prone press up. So if she's not a good active prone press up person, or, and again, it doesn't have to be a modification or a plan B, it can be plan A too. But I can get this done myself as well without her helping out. And I honestly, I like this one, but I always say, like, I don't like people that have to help out on the technique. You know, like some people talk about that high dog technique for T2. You know, can you have the person bridge up? And I'm like, why? You spend a whole 3 hours trying to teach somebody how to bridge, right? And then they're bridging and trying to help you. If they're paying you, you should be able to get it done without all that, right? And that's why I pull it down, I get up over it and dropping it. Same kind of thing. Like I could say here, like, well, I could just get this done without you having to help out. And what I'm going to do is slide in. I'm going to let her know. I'm going to come through. Just relax. I'm going to come through here and just let my forearm rest on her pec in front of her shoulder. But grab more of her torso. Don't be out more like on her arm. And then as I do that, I'm going to put my hand on her PSIS the same way. And as I sit back and pull up to here, I'm going to have to counterbalance myself through my right hand. So for every millimeter I come up here, I've got to push my weight onto her PSIS. So we're just seesawing back and forth. And I'm dropping on that back heel. You see my back heel's off the ground? So as I come up, I'm here, I'm locked and loaded, boom, fire straight down into her pelvis. So just efficient and smooth body mechanics. And I can sit there, because I'm not muscling anything, I can sit there for several minutes and rock back and forth and be pretty crispy with my drops in there. And she's small, which makes it help easier. But I just kind of sit back, drop. Let me have it. Dead weight. Dead weight. Don't help. That's not dead weight. Oh. Bad patient. Get in here, right? No! Leave your head bomb up in there. Just be a dead body. I don't need your help.
I'm not doing anything.
Yes, you are. Relax, I got you. I've actually never encountered this problem here. There, that. Get up and drop. Pull her up. Look at her head. Drop through it. I'm gonna start dropping harder if you don't mind. So you're just sitting up, dropping. Sitting up, dropping with your back heel. It's a pretty efficient position to be in. Sound good? All right, give that a shot. Oh, wait, sorry. I always forget this part. You can also go bottom up with this. You can turn the other way. No, me. You just be dead body. It's just too helpful. So I can also take the bottom leg and kind of do the same thing here. I'm still going to give her this side bending, but I can take this far leg, reach across, and hook just above her knee cap onto her quad tendon, and then switch hands. And I can kind of feel like I can squish, see that, squish down onto the posterior nominate, and then I pull up and push down. You can add a little adduction if you want to. You can even internally rotate her hip, but bring her up into here, drop, up, drop. You can see how compressive and nice those forces are if you think that's something that she needs, which most people do. You have chronic pain here. Feel how stretchy that is?
Mm-hmm.
Good. You're just saying that?
No, I can feel it.
It is.
Yeah.
See? So downstream, upstream with a little hip extension, adduction, push, pull. Got it? All right, give those a shot.
I'm already here. You can
Sounds good. Just a second.
I'll
Let
do the other
me get this set up.